If you're currently pregnant or recently had a baby, you've probably heard about a lot of tests that get done to newborns and medications that are given to newborns in the immediate newborn period. And you might be wondering, why do we do all this stuff to small children? Well, let's talk a little bit about it. Let's go through each thing one by one. We'll talk about what it is and why we do it. So, probably the easiest thing to talk about is the newborn hearing screen. So, within the past 10 years, we realized that if we identified children who had hearing loss early, we could effectively intervene with hearing therapy, meaning hearing aids for the children who needed it, and speech therapy at a much earlier time so that they could develop normal language. When children aren't screened, what we found was that kids who had hearing loss weren't picked up till after a year of age, long after we would expect normal language to be developing. And so we instituted in the U.S. a universal newborn hearing test. Basically what will happen, someone will come in, they put little earmuffs on your child, they give tones into the child's ears, and they look for response from your child's brain to see if it's picking up the sounds normally. There's nothing injected into the baby feels no pain during the exam. The most important thing actually is just that the child's sleeping so that moving around, wiggling, or crying won't interfere with the results. The benefit of this is obviously if your child has any hearing loss, we find it as soon as possible, and we can start to do the things your child needs as early in their life as possible to promise them absolutely normal speech and language development. So that's an easy one, and usually parents don't have concerns about doing a newborn hearing screen, but we do a lot of other things universally for infants. So let's talk about the next one. After your child's born, we always give babies two things, a vitamin K shot and antibiotic eye ointment. And why do we do that? Well, each is for a separate reason. We give the antibiotic eye ointment to prevent newborn pink eye, basically, newborn conjunctivitis. And newborn conjunctivitis is a little bit different than the kind of pink eye we think of in your toddler or older child or adult. If you're a toddler, an adult, and you get pink eye, it's pretty uncomfortable, but it doesn't really run the risk of causing permanent vision loss. But in infants, the kind of bacteria that can cause pink eye are typically gonorrhea and chlamydia, and these actually have a high risk for permanent damage to infants' vision. And so, by using the simple antibiotic eye cream, we can actually prevent them from developing those and protect them. There's really no side effects to them. Some children will have a little bit of redness around the eyes after the cream is applied, but that's typically it. Children don't tend to have allergic reactions or anything else to it. And the benefit, obviously, of preventing any significant eye infections would outweigh, to me, that small risk of a little eye irritation in the first day or two of life. The vitamin K shot we give is actually even more important, in my opinion. And why do we give a vitamin K shot to a baby right after they're born? Well, the vitamin K that we have in our bodies comes from our diet and from our intestinal flora. And children, when they're born, obviously haven't been eating and don't have any bacteria in their gut yet that can create vitamin K. And why is vitamin K important? Vitamin K is an essential vitamin used by our body in all of its clotting mechanisms. So those are the chemicals that go through your body and prevent you from bleeding spontaneously into your skin, from your gums, your nose, or even into your brain. Because we know infants are born without vitamin K to supply this clotting system, we give them vitamin K to prevent any significant bleeding. And why is this important? Infants who have vitamin K deficiency are at risk for minimal bleeding like bruising or bleeding from a circumcision site or a belly button. But more importantly, they're at risk from intracranial bleeding, meaning bleeding into and around the brain that can cause seizures and permanent disability. And by giving this one shot of vitamin K, we actually completely remove that risk, and that's why we give it. If you have other questions about it, I'm sure your doctor would be willing to talk to you. So, we've talked about vitamin K, we've talked about the newborn hearing screen, and we've talked about the erythromycin eye ointment. Another thing we do on all babies nowadays is what's called the PKU screening, which is newborn genetic screening. So, newborn genetic screening, much like early intervention for hearing loss, is done to identify children who have specific genetic or metabolic diseases where we know that recognizing and intervening early can make a significant impact in how healthy your child is throughout the course of their life. So an example of some of the things that we screen for is congenital low thyroid or hypothyroidism, cystic fibrosis, multiple metabolic abnormalities, the most famous of which is PKU, which is how the test got its name. So what they'll do is we take your infant's foot, we make a small poke on their heel, we collect blood on some filter paper, and we send it away. And they're able to use those 5 or 6 small splotches of blood to test for over 26 diseases that could potentially lead to harm for your child. And how can they harm your child? Well, for metabolic diseases, typically the issue is your child does not have a specific enzyme that's needed to digest the typical foods that we eat. When they consume those things, whether it be breast milk or formula, they start to get elevated levels of different chemicals in their body that they can't break down. And those can accumulate in their organs, like their liver, their lungs, their heart, or in their brain, causing permanent brain damage. If we recognize within the first week of life that your child has these metabolic disorders, we can actually avoid the foods that would damage them, provide them the appropriate foods and formulas, and keep your child as healthy as any child who did not have these metabolic conditions. So that's why we do the PKU. Another new test that's coming out is congenital heart disease screening. So just recently, the American Academy of Pediatrics and the Department of Health have realized that studies show screening children for their oxygen levels before they go home was able to pick up children who had severe congenital heart disease, meaning heart disease where the arteries and vessels coming out of the heart aren't positioned normally, leading to lower oxygen levels than the child needs to maintain a healthy life. And so by just doing an oxygen level with a sticker on their finger and on their foot before they go home, we can identify a good portion of children who would be affected by these diseases and intervene and identify them before they have any symptoms, and again, keep them safe and send you home with a healthy baby. That's a newer test that's coming down the line now, and so not all hospitals have implemented it, but in California specifically, it was just passed by the Senate Assembly and signed by Governor Brown, and will be mandated to be done universally, just like our hearing screens and our PKU screens, starting in July of 2013. So I hope this answers some of your questions about why we do so much to your baby in that first couple of days when they're just getting used to the world. And I hope that if you have any other questions, you'll ask your doctor to talk with you about them.
Medtwice.com